Shout out to all the chiropractors out there looking to grow a chiropractic practice. And when I say that out of love and respect. Are you looking to grow more chiropractic in your chiropractic practice? I know you guys, some of you guys may do other things in there, and that's fine. The question is, are you looking to grow? If you're looking to grow more of that, then the relationship you have with a practice member needs to be fostered with education to elevate that relationship rather than that of teaching. And that comes down to, are you telling or are you leading? And that comes down to, are you telling or are you asking? And that's really where I want to go with today's call with you guys. So I'm Dr. Joe Borio, founder of Chiropractic Consulting. I've been in practice 36 years. Adjusted more people probably than just about anybody that's been practicing, or one of the few that's been practicing. And we have the highest recorded PVA. It was over 400. So that would mean that people would stay with us for over 400 adjustments or more, which would be years and years of a relationship. So what I share with you is from my experience. What I share with you is what I've learned through my experience in interacting with people. And I have one motivation in my life from this point moving forward, and that is to get every man, woman, and child under chiropractic care. I want every man, woman, and child to be adjusted regularly from womb to the tomb by you, a local chiropractor, by you tending and caring for their nervous system and spine for the rest of their life. So one of the things I've learned that I'll share with you today is the difference between telling and asking. And one of the things you'll realize is that if I tell somebody something, I'm teaching them. And I'm not saying it's bad. And I'm not saying it's not going to get somebody where you want to go. But where they need to go is a better way to word it. But it's not as effective as asking. Because asking is educating. And educating means, in Latin, to draw from. I start with the idea in any relationship that they already know, they being your practice member or new practice member, new patient, that they already know what chiropractic is. They just don't know it as chiropractic. So they know that the brain tells their body what to do. They know that the brain talks to their body through nerves. And they know that all the nerves have to go to the spine to talk to the organs. Pretty much 99.9% of the people walking through your door, they already know that. They also know that crooked isn't healthy. They know that there's no health in crooked. They know the more crooked their spine is, the unhealthier that is for their body. And they also have at least some idea that crooked means the brain and spine and nervous system are not going to be able to communicate as well. They already know this. They, on some level, even if it's a intuition, a feeling, even if they can't articulate it in a manner in which, would suffice a chiropractor, anatomy, biology wise, they know that. And that's what you need to reveal. I look at it this way. I'm going to reveal what they already know, anchor that into what they need to do, and now I'm going to foster that nonstop to improve the relationship that I have with him forever. That's ultimately what I'm trying to do. So where does that go? So what I mean is, when you show somebody, let's say your criteria test is an x-ray or a thermography or a surface EMG or a weight scale or a posture photograph, or other things. It doesn't have to be just that, right? It could be other things. Or maybe it's all of those things, which we use almost all those. When you show them that, you're better off asking than telling. You're better off asking them, hey, Bob, listen, here's normal. Tell me what the concern is. Why is that bad? What's going to happen? Ask consequential questions. What's the consequence of that? What's that going to look like? One of my favorite questions that I'll share with you guys is, what's your life going to look like if that stays like that? If that gets worse? If we don't correct that? If you don't follow the recommendations? What's your life going to look like that? See, when you ask questions like that, they already know the answer. You're revealing, you're eliminating all the other baloney, and you're revealing in that conversation what they need to pay attention to, what they need to focus on. And once they do that, the recommendations that you provide are going to be a lot easier. They're going to be a lot easier. And, and the goal is to try to get everybody under care. Listen, there's some other people out there that, in our profession that teach and mentor docs on care. I'm not a guy that's going to teach how to get somebody under a 90-day care plan. I don't, why? I don't think people need care for 90 days. I don't think you should brush your teeth for 90 days. I don't think you should wash for 90 days. I don't think you should eat well for only 90 days. I don't think you should exercise only for 90 days. I think it's something you need to do for the rest of your life. Does everyone do those things for the rest of your life? Unfortunately, no. But the likelihood of them doing it for the rest of their life will definitely increase if my relationship and conversation with them from day one forward is describing and revealing the benefits of chiropractic care for the rest of their life. That's why, if you're in line with that, and that is in agreement with you, and you feel and think and can justify that in your head and your heart the same way, then my question to everyone is, why align yourself with somebody that's not teaching that? I'm not going to sell chiropractic short. I'm not going to say, well, let me try to get you in for 30 days, or let me show you how to close people for 90 days. Let me just show you how to do that. And then, we're going to increase those numbers, and then everything's going to be fine. To me, that's not winning. To me, winning and what's in their best interests. What's in the best interest of a practice member? To eat healthy for the rest of their life, or just till they lose the 5 pounds and go back to the way they were eating? What's in their best interest? To get adjusted till their backache goes away, or to make sure their brain can talk to their body and their body can talk to their brain for the rest of their life? So I'm at least going to start the relationship that way, and I'm going to nurture the relationship that way, and the likelihood of them choosing that is much higher. How do I know that? How do I say that? Because I did it for 36 years. And I did it bigger and better than just about anyone. And I don't say that to pat myself on the back. I say that to impress upon you that what I teach is highly effective. So if you're looking to see a lot of people, and I mean more than you probably could think about or imagine right now, and you're looking to have lifetime relationships with people, and you're looking to have low overhead, if you're tired of going to bed going, oh my God, how many new ones I got this week? How many new ones I got this week? How many new ones I got this week? How many people did I close this week? I'm not saying, you're not helping people that way, but if you don't want to live that life and you're really looking to live a life or I want to see more people. I want people to have lifetime. I want them to bring their kids in. I don't want to deal with symptomatic care all day long. I want people to come and get adjusted because it's good for them. I want people to have lifetime relationships with our practice members. I want people to stay under care for pay, stay, and refer for their life. Then that's what I teach. That's what's my wheelhouse. So if you're looking to grow and serve at a level higher, have more fun, have a much more profitable practice, have a 3-day work week, see more people in 3 days than most people see in 6, make more money in 3 days than most people see in a month, and have a lot more fun, freedom, and independence. That's what I teach. That's why I'm still at it. That's why I still do what I do. That's why I love this profession. And that's why I love bringing more chiropractic to people. I never thought in my life that the advancement of chiropractic was going to be less chiropractic. Everybody's providing less chiropractic in their chiropractic office. So I'm not going to do that. And I'm going to share with you the opposite. I'm going to show you how to make chiropractic like D.D. Palmer. Make chiropractic center stage in your practice. Make chiropractic the highlight. Doesn't mean other things may not be going on. But how do I make chiropractic the name on the marquee? How do I make him or her the center stage of the practice? Make everything else ancillary if you're using other things, and make it the most fun and the most profitable, and certainly the best, greatest way to impact health in our community and our profession. That's what I'm going to teach. That's what I do. Guys, I'm Dr. Joe Borio, founder of Chiropractic Consulting. Check us out. Reach out to me anytime you want. Talk to me phone-wise, email. Talk to me on Facebook, whatever. Love to hear your story. Love to hear why you're a chiropractor, what's going on. What are you doing great? What do you love? What's challenging for you? And what a relationship with me and the Chiropassion family can do to help elevate what you're doing and bring out the best in your practice, bring out the best in you, and give you a guaranteed better outlook in your future.